Hello, explorers. Welcome to RxRevelation. Introduction. Lomotil tablet is a combination medicine used in the treatment of diarrhea. It manages the symptoms of diarrhea such as stomach pain, cramps, and loose stools. Main content: diphenoxylate 2.5 mg plus atropine 0.025 mg. Uses: treatment of diarrhea. Take this medicine as advised by your doctor. Action. Lomotil tablet is a combination of two medicines, diphenoxylate and atropine, which treats diarrhea. Diphenoxylate is an opioid agonist, which works by decreasing contraction of the intestines, making the stools more solid and less frequent. Side effects. Most side effects do not require any medical attention and disappear as your body adjusts to the medicine. Common side effects are indigestion, constipation, dryness in mouth, cough, flushing of skin, blurred vision. Safety advice. It is not known whether it is safe to consume alcohol with Lomotil tablet. Lomotil tablet may be unsafe to use during pregnancy. Lomotil tablet is probably unsafe to use during breastfeeding. Lomotil tablet may decrease alertness, affect your vision, or make you feel sleepy and dizzy. Do not drive if these symptoms occur. Lomotil tablet should be used with caution in patients with kidney disease.